So thank you for joining us this afternoon. If you're joining us, I suspect that you're interested in medical physics, or at least trying to learn what is medical physics. And to that end, it is quite simple. It's physics applied to medicine. First thing I'd just like to communicate with you is it's important to know that you like your job. If you like your job, you're never going to work. It's always going to be something that you just want to do. And a career in medical physics is something that can easily fall into that, coming to work every day, being glad that you're at work. When I was first introduced to medical physics, I didn't know what it was. I had an opportunity, a summer research experience in medical physics. And I had the fortune of having an outstanding mentor. This person wasn't just a mentor, they were a life coach. And after a short time there, my mentor asked me if I would like to uh, go to the examination of a patient that had just come into the clinic. And I accepted that opportunity. The patient was a cancer patient. And what I saw made me angry. I saw an extremely aggressive tumor that was devastating this patient's body. She had presented to the clinic. Her husband had brought her in because she was trying to commit suicide. And she was trying to commit suicide because of the sheer pain of this cancer. So we took the patient to MRI and we evaluated the patient with MRI. And in the imaging, we noticed that the tumor, although it had invaded a large portion of the breast of the patient, had not invaded the heart or the lungs. And that gave us hope that the prognosis might be better than originally anticipated by just looking externally at the patient. During the summer, I helped plan that patient's radiation therapy. I did calculations with my hands and the computer utilities that were available at the time. And I was also hands-on forming radiation protection equipment for the patient so that healthy tissues would remain unaltered by the radiation therapy. Sometime later, I was able to visit the patient in their room. And what I saw was the patient's children were trying to grab mother's hand and dance with her. And she was smiling. The children were happy. And it struck me going from wanting to commit suicide to dancing with your children. That's something worth living for. That's a life changing experience for a human being and their entire family. And I wanted to be a part of that. Well, that was just as an undergraduate in physics. So immediately I knew now, not everybody is going to have a life changing experience like that. Nonetheless, a career in medical physics can be very rewarding. It's a very clean career. You work in the clinic to start out with. As a medical physicist, you will be helping doctors derive the best information from images. You'll help them get those images. You'll make sure that the equipment is working at its top performance abilities so that you become essentially the radiologist's photographer. You set up the protocols to get those images and you make sure that they're going to be that same quality during the year and every year thereafter. But we're not just working with x-rays as medical physicists. We also work in other fields, ultrasound, MRI, radiation therapy. One of the things that you might ask yourself is, do I have what it takes to be a medical physicist? Well, if you're coming from a background of mathematics, physics, or engineering, or similar related sciences, the answer is most certainly yes. If you take a look at this equation right here, This equation is quite simple. This is the exponent here, where x in the exponent is simply distance in a given direction. And here, this coefficient mu, well, we're going to spend the next 2 years talking about that. But if you can handle this equation, and if you can look at a picture like this and identify a fracture in this tibia, then you definitely have what it takes to be a medical physicist. As a physicist in medicine, you're going to be dealing with things that you've been dealing with basically since high school. Angle of incidence equals angle of reflection. Refraction happens in density change, different media. And finally, scattered radiation might come out, absorbed radiation might stay in. These are very simple concepts for the physicist, but you'll be introduced to things that you haven't had an in-depth, detailed description of probably in your programs, which are the equipment that produces those X-rays, the intricacies and how it all works and is put together, and the physics and electronics and chemistry behind it. And this can be extremely exciting because that equipment immediately, as you turn it on and you push the button, begins to react according to strict physics principles that a mathematician, a physicist, or an engineer can calculate, predict, and then show that those calculations and predictions are exactly what's happening. And when they don't, you know immediately the equipment is failing and it needs to be changed. So with ultrasound, we can have the experience of counting the toes of an unborn child. But as a physicist, we're worried about using ultrasound with too much intensity that might heat up and maybe harm that child. So our job is to make sure that the ultrasound equipment is getting excellent images, but working within the parameters that would never allow that to happen. And in MRI, well, MRI, we're using radio frequencies and strong magnetic fields to visualize thought in real time. And finally, radiation therapy. Radiation therapy is basically surgery with no knives, no scalpels. We use various forms of radiation to penetrate the human body to target a tumor specifically and burn out that tumor while maintaining excellent tissue quality and health for non-tumorous tissues. These are the various ways that medical physicists work in the clinic, and their job is to make sure that all of these pieces of machinery are maintained at the highest quality standards and at the same time producing excellent medical results. Finally, though, there's another field that a medical physicist might be occupied with, and that is to become a radiation safety officer. Radiation safety officer is really responsible for the protection of people and educating them to the use of equipment and the quality of the equipment, but also keeping track of the safety of that equipment, making sure that radioactive isotope, for example, doesn't get into the wrong hands. So the radiation safety officer is the historian during the year for all the radioactivity use and training programs inside the hospital, and they will report to local authorities and also to the Nuclear Regulatory Commission. Now, you might say, okay, well, that all sounds interesting, but what does a career in medical physics pay? Well, to give you some comparisons from national numbers, a mathematician's median pay is about $90,000 a year. A physicist could expect $120,000 a year. An engineer, $140,000 is median pay. A medical physicist starting out, median pay is approximately $140,000 a year. And with board certification, the median is about $190,000. If you would go on and get a PhD, you can add about another $10,000 a year to that career trajectory. So this summarizes the basic duties, the basic environment that a medical physicist goes through, and various different opportunities within the field of medical physics. Sometimes you may have heard of the term health physics. Well, health physics and medical physics are similar fields. They both are concerned with radiation, radioactivity, radioactivity production and radiation production and protection. But a health physicist is more on the safety, protection, and cleanup side of radioactivity, where medical physicists will be focused on the medical applications of physics and how to diagnose and treat disease. I hope this information has been helpful for you and describes probably some of the aspects of a medical physics career that you didn't know and might help you decide whether it would be a career interesting for you or not.